Gabriella was born early, around 36 weeks, and she had struggled with respiratory issues throughout her entire childhood.
She was misdiagnosed with asthma. She was unable to do what most children can do as far as running or things like that. She would get out of breath fast.
I've always wanted to play volleyball and basketball when I was younger. And when I was at school, I would try to play them, but then I'd always get very exhausted and I'd have to sit out.
Gabby would be very frustrated because she would take her meds and she was still sick.
She would be coughing 14, 16 days straight in a row, nonstop, and there's nothing you can do for her.
When we came to Cook and we met with Dr. Pancham, we finally felt like for the first time that, okay, somebody understands what possibly might be wrong with Gabby.
He came in and he says, we have a diagnosis for Gabby. He says it's called Tracheomalacia. And I said, okay, what's that? And he explained that it's the narrowing of the airway, and that's why she is not getting the oxygen that she needs, and a little bit more detail. And to me as a mom, I started crying because it was the first time in 10 years we actually had a diagnosis for Gabby.
We are able to take care of their kids, and we are able to tailor the management to their kids' conditions, and we have been successful in getting these kids to a spot where they're normal.
When she was done, the way she describes it, she said it was for her, it was like her breathing to a coffee straw, and then afterwards, I don't know if you know the boba straws, it was like she could breathe so much better.
That was a very exciting and very relieved for me to see a child who at this age has been suffering for 12 years and once got the tracheopexy done, finally felt that air is going to her lungs. And so I was very relieved to see that she can breathe again.
My hope is that more people can become aware of what tracheomalacia is and change children's lives when they're younger.